COVID's back, baby. Now, the mainstream media's narrative is conspiracy theorists spread false information about the return of COVID-19 mandates. And that conspiracy theorist they are talking about is Alex Jones. And here's the clip in question.
So I get this call, and I'd actually gotten it on Tuesday evening, but I had so many messages I wasn't listening to it till Thursday in my office. And I know this person for 20 years, and they're high up in the transportation system and the TSA. It's actually the agency above them. And so I called them up, and they said, hey, I'm in town. Let's go meet. So I went and met them, and they said, listen, they called in the managers. This is going to happen middle of September. They're going to try to make all the TSA workers in airports wear them. Then by mid-October, Biden's going to try to bring back masks in the airports and on planes. And I said, well, that's insanely unpopular. What's their excuse? And they said, well, this new variant out of Canada that they say is so bad and hospital numbers are up. So you're going to see a rollout sometime in September of all this. And that's what we've been told. So then I got on the phone, called a few other feds I know. One of them answered with the Border Patrol. They said, yeah, we've been told COVID restrictions are coming back next month as well, that they'll be phased in.
Now, we will have to wait till September to see what happens, but Alex Jones has a damn good track record when it comes to his predictions. And the narrative is already beginning to take shape.
COVID is making a comeback this summer, so many of us would like to leave it in the past, but cases are once again on the rise. So when will new booster shots roll out? Ann Thompson asked the CDC director.
This summer, most Americans left COVID in the past, gathering together once again mask-free. But tonight, signs of a COVID resurgence. Across the country, COVID hospitalizations jumped more than 14% in the most recent week, but far lower than pandemic levels. NBC News medical contributor Dr. Kavita Patel.
What's behind this uptick in COVID that we're seeing?
The main driver of this is a variant that's relatively newer to the scene, EG5. It's easier to give and get, so that makes it kind of easier to pass along.
It's been almost a year since the last COVID booster came out. CDC Director Dr. Mandy Cohen.
The new COVID booster is expected to be approved by the FDA, and then we will make recommendations from the CDC probably by the second or third week of September.
Will it protect against this new strain?
Yes. The booster is tailored to what we are seeing circulating now.
Critics say the federal government is behind once again. People knew there was going to be a COVID resurgence. So why don't we have a booster today? Why do we have to wait until next month?
The way we go about doing just like we do with our flu shots, right? We make sure that we're looking at the ways in which the virus changed. They look at and evaluate that. The FDA is doing its work. We likely will see this as an annual COVID shot, just like the flu shot.
Just in time for fall, when we'll also face RSV. Can you take the flu shot, the COVID booster, and the RSV vaccine all at once?
So for flu and COVID, yes. RSV, again, is only available for older adults. That's one where I'd say talk to your doctor about what's right for you.
So until the new COVID booster comes, get prepared. Stock up on at-home tests. They do cover that new strain. Keep a mask handy in case you're in a crowded place. And most of all, get your shots, COVID, flu, and RSV, all by Halloween to give yourself your best chance of staying healthy.
A reminder that COVID never went away.
A reminder that COVID-19 never went away. It's getting odd. I don't like it. And after that NBC segment, we start seeing articles like this pop up. Lionsgate reinstates mask mandates in parts of Santa Monica office following COVID outbreak. Atlanta-based Morris Brown College says they are reinstating COVID mask mandates. Rutgers will still require COVID vaccines. Over 100 schools will require students to be vaccinated this year. Rutgers guidelines sparking some outcry in New Jersey. If they are so worried about conspiracy theorists spreading false narratives, they need to stop making it so fucking easy to connect the dots. Because you're going to get people like me saying, that seems a little weird. I feel like I've seen this before, and I know where this road leads to. So let's never forget how they scared us into submission.
New warning from the World Health Organization. The death rate from the coronavirus is rising.
3.4% is higher.
Twice as deadly as previous estimates.
3.4%. The state of emergency.
Well, I think the 3.4% is really a false number. Based on a lot of conversations with a lot of people that do this, I think the number is way under 1%.
So to fact check, the World Health Organization says the coronavirus death rate is 3.4%.
President Trump lies that the World Health Organization is wrong.
The number is 3.4%.
3.4% is what it's being reported around the world.
Making it deadlier. So much death.
The death rate.
The percentage is 3.4%. And no hunch from the president can change that.
Trump lied about the most recent World Health Organization estimate that the global death rate of coronavirus is 3.4%.
The 3.4% death rate was wrong, and WHO data later updated it to
a fraction of 1%.
Let's go back into history.
Trump has a hunch that the death rate is lower than 1%.
Way under 1%.
Way under 1%.
Will someone put a mozzarella stick in his stupid hole?
Trump lied to viewers about the mortality rate.
Way under 1%.
False information.
He's spreading disinformation.
Misinformation and dangerous disinformation.
If you're president of the United States, you have the world's greatest scientists at your disposal. You listen to them.
Leading scientists, including Dr. Fauci, wrote in the New England Journal of Medicine that the death rate could be considerably less than 1%.
Way under 1%.
Why are you going on national television and contradicting experts based on a hunch?
His fake hunch with some fake math. The president somehow thinks it could be lower than 1% based on nothing.
Based on a lot of conversations with a lot of people that do this.
Outright lies, contradicting health officials on fatality rates.
It's not a time for Donald Trump to be calling into cable shows. It's a time for the CDC.
What is CDC's best estimate of the fatality rate?
It's somewhere between 0.5% and 1%.
A fraction of 1%.
The president is spreading false information.
Discarding what the health professionals are saying.
Outright bogus information.
Science is not based on hunches.
A hunch about what he thinks is going on.
Instead of trusting information from doctors and scientists,
He has a hunch.
Hunch.
It's not a time for Donald Trump's hunches. It's a time for science. It's a time for doctors.
Welcome, Dr. Jay Bhattacharya.
My hypothesis
My hunch
was it is likely to be less deadly than the World Health Organization was saying.
3.4%.
There's no way that was true.
Really a false number.
This is why I ran the study in April of 2020.
And what did you discover?
The infection fatality rate was 0.2%.
Way under 1%.
Trump continues to contradict and downplay all things coronavirus.
The president appearing to contradict medical experts on the mortality rate of the virus.
Personally, I would say the number is way under 1%.
Later on CNN.
Our estimates are probably pretty inflated.
Very high because the easy cases, they don't report to doctors or the hospital in many cases. So
initially, WHO released estimates of 3.4%.
Really a false number.
The true infection fatality rate is likely to be far, far less.
Way under 1%.
It could be in the range of a seasonal influenza.
A fraction of 1%. This is just my hunch.
He is spreading misinformation and disinformation.
You can even call it information.
An outbreak of sketchy information coming from the president.
He's using a hunch instead of listening to the Global Authority on Public Health.
A hunch.
There's a lot to be concerned about.
His hunch.
A hunch.
Hunches.
Just my hunch.
His hunch.
His hunch.
My hunch.
Based on a lot of conversations with a lot of people. That's not what you want for the American people.
A hunch.
There you go. And thank you to Matt Orfilia for putting that clip together.